Malaria cases are rapidly spreading across Tigray, with the region unable to control the spread due to the widespread destruction caused by the war. The war has severely damaged health infrastructure, leaving the population with limited resources and no effective means to combat the surge in infections. Girmay Teki, a young gold miner from Adnabrid in northwestern Tigray, shares how he has been exposed to malaria.
I couldn't recognize at first that it was malaria. I had trouble sleeping and only realized the issue when my eyes turned yellowish. I was informed that I had contracted malaria. Now, after receiving treatment, I feel much better, though the pain is very intense. The outbreak was caused by contaminated running water flowing from Adinabri to our work area, which is why we were exposed to the malaria epidemic.
Another patient, Burza Fissaha, a resident of Tahtay Koraro, has also contracted the disease and attributed spread to the absence of effective prevention and control mechanisms.
The
deputy manager of Suhul Hospital in Shira, Tesfaski Gabrehiwat, reports that the hospital is treating significant number of malaria patients, most of whom are from gold mining areas.
We have observed a significant increase in malaria cases, even at a regional level. Our hospital also provided services to people from the northwest and western domes. Currently, compared to previous periods, the epidemic has shown a rapid rise.
Malaria Prevention and Control Coordinator at Tigray Health Bureau, Aragai Gabrametin, reports a significant surge in malaria cases over the past 4 weeks, with a sharp increase in infections across the region.
The number of malaria cases has now tripled, with approximately 17,000 people infected across all districts of Tigray. However, the prevalence varies by area, with the northwestern district being the most severely affected, and these areas are considered malaria hotspots.
The coordinator expresses concern that the region is facing critical shortage of supplies, leaving inadequate resources for effective malaria control and prevention efforts. He stated that despite the past efforts to control malaria with chemicals, the region now faces a crisis due to the insufficient response from the federal authorities.
Among the 66 districts highly susceptible to malaria, only have received mosquito nets, resulting in a 50% distribution rate. Although chemical treatments were planned for 25 districts, even 6 of them have not been fully supplied. Therefore, we are in a state where there is no adequate supply for effective malaria prevention. In the past, we used chemicals in the most affected areas to curb the spread to other regions. However, we're currently unable to do so. Despite the Health Bureau's plans and requests to the Federal Ministry of Health for assistance, we have yet to receive a response.
The lack of response from the concerned federal authorities has left Tigray vulnerable as it struggles to contain the growing malaria crisis.